My name's Laura Dixon. I've done this for many years, and so what we're covering today are the nursing standards section within the conditions of participation. The conditions of participation, that is the manual from which CMS works off of. Number one, when they're determining whether or not the hospital, whether it's acute or critical access, is going to participate, what are the rules and regulations around it, and that's what they also use when they come around and do a survey. Now, surveys are there's a couple different types. Of course, you have your general certification when you're just coming on board and you want to get that agreement. And then there's a validation survey that might occur when you are going through, say, another company, whether it's Joint Commission, D&V, whichever one it is. And they want to do a validation survey to make sure everything's going according to plan, so to speak. And then there's a complaint survey. What I'm going to cover today are the nursing conditions of participation. By the way, the manuals are split out into two different manuals, and I'm going to explain what those are. Actually, it's one manual with multiple appendixes, depending on your hospital type. I want to start with a quick introduction again. This is why we're here, so you don't get one of these, and that is the statement of deficiencies and a plan of correction that you have to put into place. And of course, you definitely don't want the notice of involuntary termination from your Medicare or Medicaid agreement. That could be, of course, devastating for many hospitals. The manual itself is, again, the conditions of participation. They're split into section numbers called tag numbers. That is how CMS surveyors come around and identify whether or not there's a deficiencies. The regulations themselves came from the Federal Register. That's what Congress puts into place, says, yes, this is what you must do. And they first came out in 1986. The nursing tag numbers for the manual starts in 385 through 413. That is for an acute hospital. Now, for a critical access hospital, they have clumped it all into an area called provision of services, and they don't have their own separate section. As I mentioned, the regulations start in the Federal Register. Then CMS comes along and puts in their interpretive guidelines. This is what we want to see in place. This is what we expect of the hospitals in order to comply with that regulation. Some also have survey procedures, and it's just that. That's what the surveyor will do when they're on site. Now, I'm going to give you the heads up. These are not all-inclusive questions. If any of you have ever been through a survey, and most of you probably have, you know, they take a lot of time in your hospital, and they ask a lot of questions, and they look through a lot of documents. So be aware, just because it's in there, it's not the full amount of questions they may ask. It's also beneficial for you or your compliance officer to keep up with these changes. Now, with the new administration, there's been a lot of changes going on right now. So, of course, what you want to do is make sure you have the current manual itself. The last one was updated in February of 2020. So you may also want to have one or two people go in and sign up to get copies and access to the Federal Register as they come out with some new rules. Again, that will keep you up to date on, oh, this is going to be coming down the pike. Always check the survey and certification website. It's essentially that. It's what CMS sends out to their surveyors to say this is what we have to have, this is what we expect to do. And of course, if there is a new manual that comes out, start with the transmittal page, because that will show you the changes. It's much easier. So just a quick few screenshots. This shows the actual appendix for the entire manual. You will see it is set out according to hospital type. In February 2020, they eliminated a separate manual or appendix, so to speak, for psychiatric hospitals. They added those to the acute. They felt there was so much overlap, it was just easier to include them. And besides, some hospitals actually have psychiatric units within them. And this is just the continuation. Critical access hospitals is in Appendix W. Each appendix has their own index, which lists out what's the code number and then what are the sections as they have separated them out. And as I mentioned, this is the one for Appendix W. There were multiple changes to those conditions of participation. Now you'll see here I'm starting with one that addresses pharmacy. And think, well, why are we talking pharmacy? I thought this was nursing. Anything that happens within a hospital, well, the majority of it anyway, affects nursing, as does the pharmacy part of it. Now, what happened with the pharmacy changes that they did implement? They were to make some changes back in December of 2019, and also with the USP, the US Pharmacia. What happened is there was an appeal filed because of some of the information that was in there. They felt, no, that's unrealistic. Now, normally CMS dovetails all of their recommendations and all of the information off of these national organizations, those who establish the standard of care, and the USP was one of them. Well, what CMS decided to do is because, number one, there were so many changes coming down so fast and furious, they were having troubles keeping up with it. So they decided, you know what, instead of actually putting those requirements into our conditions of participation, we're just going to turn it around and say, refer to. So that's what they did. So now what they're doing, CMS, is saying you have to follow federal and state laws, of course, and any national guidelines, such as pharmacy guidelines, those from recognized organizations. So that way they don't have to come back and print up a new manual every so many months. I mentioned here, this is to sign up and get the Federal Register. That's how you do it. Include your email address, hit submit, and you will start getting emails. I get them almost daily, Tuesday through Friday. And sometimes Saturday I will get an email that will update me with changes that are coming down, whether it's proposed regulation changes, changes to new requirements for hospitals. And by the way, this includes everything that's under the Federal Register. So you may get information from Children's Services, you may get it from the WHO or from the National Institutes of Health. It's not simply Medicare and Medicaid. This is a screenshot that will show you the survey memos. You will want to click on the posting date about 3 times to bring you to the most current one. I've included the web link in there. You might want to just type it in as opposed to copy paste, because sometimes it doesn't come through once you do hit the copy paste. I'm going to do some brief overview of some of the final changes that went through on the nursing conditions of participation. They went into effect back in 2019. It's under the Hospital Improvement Rule for short. What they talk about, and essentially what they did, was they changed certain definitions, such as the licensed independent practitioner. A licensed independent practitioner does not include a physician assistant. And so there was a lot of restrictions coming down as a result of that. And one in particular happened to do with ordering of restraints and seclusion. Any of you who work in that behavioral health unit, you know, PAs are very much involved in the care of those patients. And so they were very restricted in what they could do. And so they changed it from independent practitioner to a licensed practitioner. So now they can do that. That's in those states where, of course, they are permitted to do it. They changed the history and physical, that you don't have to have a full nose-to-toes history and physical on those healthy patients who are having outpatient procedures or surgery. Rather, you can just do an assessment. Critical access hospitals, unfortunately, it doesn't apply to you. They chose to not include critical access hospitals in those options that can do this. It also requires hospitals to have antibiotic stewardship programs. There is a whole section on QAPI, massive changes with QAPI. And it talks about system-wide, how you have to have policy and procedures in place, and they rewrote all of the standards for critical access hospitals. Now, part of the problem that we ran into with this is, where do you find this stuff? Because if you pull up the manual right now for critical access hospital, you won't find the changes on some of them that went into effect the end of March. So you do have to go through a couple areas in order to find them. I've included those in the index. By the way, if you have trouble getting hold or finding some of these resources, feel free to reach out to me. My email is on the second slide, and I'll be happy to get you how you find where this stuff is, because it's not in the manual as it exists on the website today. There were changes in emergency preparedness. For psychiatric hospitals, it talks about who can write in the progress notes. Now mid-levels can do so. Multiple changes to infection control. This affects nurses, by the way. It also talks about the preventionist, what we used to call the infection control nurse, and what their duties and responsibilities are. And again, that system-wide program you can have, with the exception of critical access hospitals. They clarified, in particular, those changes, they clarified the need for a nursing supervisor, sufficient staff, and also the immediate availability of an RN. We're going to cover these during this program. You have to include in the policy outpatient areas that need an RN and those that do not. In all policies, the approval has to be by the CNO. The need for a current care plan, nursing care plan. Evidence of reassessment that includes not only what you saw in the patient, but what's the patient's treatment goals and preferences. All nurses have to follow P&Ps. That was new. And the CNO, there you have to evaluate clinical activities of all nurses, whether it's employed or agency nurses. You have to have policy and procedures on prohibiting discrimination. Now, you think this is just common sense, but many hospitals weren't aware of some of the requirements they had to have in place. And in fact, CMS just came out with some new requirements as of Monday, on what they're going to say we cannot discriminate against. We also have to give information to patients in writing so they understand on their right to be free from discrimination. Talks about an order for drugs. And then again, the annual evaluation. Not just, again, your established nurses, your employed nurses, but agency and or traveling nurses. They have to have a policy that lists patients that must have an RN, an order for medications. We talked about that, except, of course, flu and pneumovax, and how verbal orders are to be used infrequently. I want to talk also briefly now about the 3 worksheets. Now, the worksheets are essentially that. It's what the surveyors take in when they go in to do an evaluation. There's 3 of them: discharge planning, infection control, and QA/PI, also known as performance improvement. The discharge planning one was revived in 2020. They made changes, draft changes, to the infection control, and that was based on a pilot they did with 40 hospitals. I have the links in the appendix for you. The nice thing on the worksheets, and I would urge you to pull them down, keep them handy, print them off, review them, use them as your self-assessment tool.